Okay, Larry Anderson, Life and Reason. This video can go under chronic pain and depression. I want to talk about. I think I'll split this up into two. The first one I want to talk about. Let's talk about exercise first. Right now, when I get out of bed and do anything at all, I'm supposed to wear a corset. It's a white thing, white girdle thing, and my physical activity is it's supposed to be kept to a minimum now. As a matter of fact, the doctor was a little bit nervous, the neurologist, about approving the steroid injection that I'm going to have tomorrow, because the steroid injection, the last one I had, helped with my pain, and he doesn't. I am an A-type personality, and when my pain goes down, I want to do anything. I want to do something. So if there's weeds out in the yard and I've been walking past them, or just looking at them, glancing at them out my window or whatever, they if I feel good, I'm all over them, and then I'm back in pain. And now it's actually dangerous for me to do that sort of thing. So my physical therapy is yapping to you right now, but my exercise. Am I talking physical therapy or exercise? Exercise first, I think. Okay. When you're okay, the best kind of exercise for depression and chronic pain, if you can do it, is walking. Is being outside and walking, not on a treadmill, but actually in the world, outdoors, so that you expand your visual horizons and you allowed yourself to be touched by nature, or by pavement, or if you live in a city, whatever it is that you're touched by, so that you see things that stimulate. You see things in the world that stimulate inside of you. So it's an outer, inner kind of movement. Now, if you're as far as lifting weights and all that other stuff, I leave it up to you. The one indoor exercise that I would recommend, again, check with some doctors and stuff, but I've actually had quite a few people in the medical field that I trust tell me that for spine injuries like mine, the ellipse is the best. Ellipse, it's a, look it up, I don't know, I don't want to describe it. It's a standing upright machine that the from the side, the legs go in an ellipse. No, it goes like this, in an ellipse. Your legs go not quite in a circle, so there's no up and down. There's not like a stair climber, and it's not like a treadmill. Because walking outdoors is great, except if it's hard on your spine or hard on whatever else your chronic pain location might be, neck or jaw or whatever it is. But the ellipse gives you some upper body workout, and it's the least impact of any exercise that actually does anything that I know of. So I'd really recommend an ellipse. And walking backwards is better on the spine, at least I found, and I have people in the medical field that I've talked to, physiologists or physical therapists, that agree that the backward movement is easier for some reason easier on the lower spine than the forward movement. So get yourself an ellipse and walk backwards. Not fly, move. Ellipse backwards. That's about. Oh, if you're depressed and you're not in pain, get it up to jogging if you can do it. jogging distance releases all kinds of wonderful natural chemicals in the brain. When I was able to wait a long time ago, when the chronic pain wasn't as severe, which I only had a period of a few years when this happened. But one of the things I did was I'd jog. I'd run I think 11 miles almost every day because it made me feel good, and it was a different kind of pain, the physical exercise thing, but it was very good for the other pain. So jogging is a good thing for the depressed people. I don't know that you could jog and be in chronic pain. I've never been able to. Oh, okay, so that's it for exercise, I think.